Hi, good day everyone. You're welcome back to Gifters, my YouTube channel. Today I'm going to be sharing with you on the topic how to prevent pregnancy, the ways you can prevent pregnancy. Okay, so we have some ways we can prevent pregnancy. We have some barrier method that you can prevent the sperm from getting to the egg. We have the barrier method, you can prevent it from getting to the egg, and we also have some contraceptive that you can take to prevent pregnancy. Some contraceptive that you can also take to prevent pregnancy, and also as a contraceptive for preventing pregnancy. If there's another way you want to prevent pregnancy, is abstaining from sex also can make you prevent yourself from pregnancy. But if no, you cannot abstain from sex and you are the type that you want it, then the only way you can also prevent yourself from getting unwanted pregnancy is there's contraceptive you can take, or you abstain. So today I'm going to be sharing with you the method, the list and the names of those things that you need to prevent pregnancy. Okay, so the barrier method from allowing sperm to get to the eggs is also there. So number one on my list today I'm going to be sharing with you. But before that, if today is your first time coming across my YouTube channel, please like, share, subscribe, turn on the notification bell so you don't miss out on our video. And if you're a return follower, this is Gifted Smile, say a big thank you. Alright, welcome back to my channel. So today let's begin from the ways, 15 ways you can prevent pregnancy. So number one on my list is make condom. We have the make condom. It has 80% effective against pregnancy. We have it has 80% of preventing pregnancy. That's the make condom, number one. But there's ways that you can use this condom that can really help you to prevent those pregnancy. Okay, one, before getting a condom as a male, you must check on the size of the condom. Okay, and two, you have to wear the condom. You have to wear the condom from the erect penis. Okay, you have to wear the condom on the edge of the erect penis, and also you pinch so you can remove hair. From the condom. Then you can wear it. Then after the intercourse, you don't just pull it out. Okay, you have to hold the cap of where you fist out the ending of the round where the condom is being fist. Then you hold it, then you pull out. Because when you don't, or mistakenly you just want to pull it out, it can get slip off, or rather it can get tear. So when you hold gently and you pull out. Okay, so number two, we have the female condom. It is also helpful. The female condom is also helpful in avoiding pregnancy. And number three, we have the diaphragm. Okay, the diaphragm here we also have is a contraceptive that is placed inside the vagina. It is a contraceptive that is placed inside the woman's vagina. So in this contraceptive, it is placed few hours before sex. It is placed few hours before sex, and you can only remove it after 24 hours. After your intercourse, you can remove it after 24 hours. But before your intercourse, you have to place it few hours before the sex, and you remove after 24 hours. Okay. So number four, we have cervical cap. We have cervical cap. A cervical cap is a soft silicone. It's a soft silicone cup that is placed deep inside of vagina. It's a soft silicone cup, very soft. It is placed inside of vagina, very deep. You have to place it very deep inside of vagina. It covers the cervix. The reason why this silicone cup is placed very deep inside of vagina is because it helps to cover the cervix, to stop sperm from reaching the eggs. Okay, it helps to prevent sperm from reaching the egg inside the woman's vagina. So that is the reason why when you want to fix the silicone cup, you fix it so deeply so it prevent sperm from getting to the egg. And number 5, we have what? Sponge. We have sponge is a contraceptive. Okay, sponge is a contraceptive. Is a contraceptive sponge. Is a method of what? Of birth control. Is a method of what? Birth control. A sponge is a contraceptive of what? A method of what? Birth control that helps a person, okay, can buy without a prescription. It is what? It is a method, a contraceptive sponge. Okay, it is a method of what? To block entry to the uterus. It is also placed inside the vagina to do what? To block the entry of for the uterus. So which means sponge, we have what also called what? Sponge, which what is a contraceptive that can also be placed inside a woman's body, what? To prevent the entry of what? To block the entry to what? To the uterus. Okay, so number 6, we have what? Dispensidine. We have what? Dispensidine. Okay, the dispensidine is what? Is a chemical that what? That deactivates sperm. Is a chemical. Is a chemical what? That deactivates what? Sperm. A chemical that deactivates sperm. Okay, so number 7, inside the dispensidine we have what? Hormonal method. Dispensidine has hormonal method, so it forms birth controls, prevent conception by stopping ovulation. Dispensidine has what? Hormonal what? Method, and during this hormonal method, it is the way to prevent your ovulation. It prevents your conception, and also what? By stopping your ovulation, which is the release of egg. By stopping your ovulation, which is the release of egg, okay, and from the ovaries. You know, when your egg is being released in the ovaries, okay, that is when you're pregnant. Okay, but in this method, in this hormonal method, it prevents you from getting pregnant. In other words, it is a concession by what? Stopping ovulation, which releases of egg from the ovaries. This type of contraception does not protect against STIs, which is sexual transmitted infection. It does not prevent against STI, sexual what? Transmitted infection. This hormonal method does not what? Prevent. It does not prevent, which means, in other words, when you are having this pesticide under what? Hormonal method, you are permitted to what? To be affected by sexual transmitted diseases, because it does not prevent you against what? Sexual transmitted infection. No. So people will tell you, I'm taking this, will it prevent me from infection? Will it prevent me from this? Will it prevent me from that? There are some things that you take which does not prevent you. In this pesticide method, it does not prevent. It do not protect against. It do not protect against STI. Okay? So number 7, I have what? Contraceptive pills. I have contraceptive pills. We have 2 types of pills. We have what? The combined pill. The combined pill. I have to break it down to your understanding. Contraceptive pills, number 7. But under contraceptive pill, we have 2 types. We have what? The combined pills, which contain estrogen and progestin. It contains estrogen and progestin. Should be taken daily and having a monthly what? Period. Okay, this combined pill, it is very necessary that you take it every day. It is taken daily, And while taking it every day, you will also be seeing your menstrual flow regularly. You also want to be seeing your menstrual flow regularly. The way you ought to be seeing it, you ought to be seeing your menstrual flow regularly. Then we have what? The mini pill. The mini pill. I told you it has two types. The first type is the combined pill, while the second one is what? The mini pill. The mini pill, which contains the progesterone, must be taken at a particular time. For example, if you are to take it from the first day, if you take it 8 a.m., note that on Monday you take it 8 a.m., Tuesday 8 a.m. You don't have to default your time or before the time. No, exact at the time you have to take it. Okay, so this particular mini pills is being taken it is being taken particular time every day without a break. You don't have any excuse of not taking it, as long as you know the purpose you're taking it is for prevention. So which means you don't have an excuse for not taking it. So it is a pill that you need to take on every daily particular time. The mini pill will not necessarily have a scheduled period. When you are on that mini pill, you don't have a scheduled period, which is your period can come at any time. It will just scatter. You can see it on the 4th today, on this month, next month on the 16th. It will just scatter. So that is why he said it is not particularly not necessarily have a scheduled period. No, you don't have. It does not have when you say every month on the 4th I'm seeing my period. But on a mini pill, you does not have a necessary scheduled period. No. Okay. Then number 8, I have patches. What? Patches. Patches is what? Is a contraceptive patch on the back. Is a contraceptive patch on the back, on the stomach, on your upper arm, and on the buttock. Okay, a person must wear each patch every 3 weeks. I have to write down so I don't forget. A person must have this patch, okay, every 3 weeks. It is very necessary. Okay, when you're being prescribed on doing things and you know those things are helpful to you, in as much as you know it is helpful to you, you have to do it accordingly. You have to follow the procedure, because once you made the mistake of not following the procedure and you easily get pregnant, you say, this thing failed. Not because it wants to really fail, but because there's a loophole, there is a mistake already in between. When a mistake is already made already. So that is why we advise you, when you are being given an instruction on how to prevent yourself on anything about health, trying as much as you can to do to protect against it. So, like I said, this one is for 3 weeks. You have to wear this patch for every 3 weeks before removing it for 1 week. Any pack you wear for a patch for 3 weeks, so which means on a week you have to remove. A week, which means for 3 weeks, if you wear, you remove for 1 week. Okay, and it's allowed for menstrual period. Seriously, it allows you on your menstrual flow regularly. It does not have issues with your menstrual flow. There is a small risk of skin irritation. The only thing you can get is skin irritation, like maybe eczema or anything skin disorder, but you can get your menstruation regularly. And also I have injection. There are so many injections you can take. That's number 9. There are so many injections you can take to prevent pregnancy. So many injections, like we have Depo-Provera. It's 90% effective. 90% effective. Depo-Provera for 12 weeks. Depo-Provera injection for 12 weeks. Okay, but for me, I don't advise young ladies to do this. Okay, but as long as you know yourself that any little thing you can get stuck Okay, when I miss talk, as a lady, you understand that any little step you take, any mistake you make now, you can get stuck. Yes, you are free, you can do it, but while doing it, follow the rightful what instruction. Okay, so number 10, I have what vaginal ring. That's Nuva ring. I have vaginal ring. It's a plastic ring. Okay, plastic ring placed in the vagina for 3 weeks. Plastic ring placed in the vagina for what? For 3 weeks. That is why we call it what? Nuva ring. Nuva ring. Okay, all right. So it's release hormones into the body. It's release hormones into the body. This what? This vaginal ring does what? It releases hormones into what? Into the body to prevent pregnancy. So which we don't even have to stress. Once the ring is this place and it starts to regulate, it does what? It helps you to release hormones into your body to prevent what? Pregnancy. Okay, and also the ring must be removed for 7 days to allow a menstrual period before inserting a new ring. In other words, when you are on this ring, you cannot get your menstrual flow. So in as much as for you to get your menstrual flow, you have to remove the ring, okay, for 7 days, which means when you wear it, you remove it, you count 7 days so you can get what? Your menstrual flow. You can only get your menstrual flow when you remove. That is what? The vaginal ring. Then the number 11 have what? The IUD. The IUD is a small device that is inserted into the uterus. It is a small device, uterus. That's the what? The IUD. Then we have 2 types of IUD. We have what? The 2 types of IUDs. Okay, we have the hormonal. We have what? The hormonal IUD. Okay, let me bring it out because I wrote this down. The hormonal IUD is what? An IUD lasts for what? At least 5 years. It lasts for 5 years before it begins to what? Before it needs replacing. Which means you can keep this for inside of you for 5 years before it's used what? You need any other replacement. Okay, so IUD do not completely stop ovulation, but act as a contraception by sinking the cervical mucus to prevent sperm from reaching what? The uterus. Which means IUDs what? Does not prevent your what? The flow of your what? Ovulation, but it serves as a contraception. It serves as what? A contraception what? To prevent what? By sinking the cervical what? Mucus to prevent from entry the sperm from entry what? The uterus. Okay, from preventing what? From reaching what? The uterus. And we have the what? Number 2, we have what? The copper based. This hormone free IUD is covered in the copper wire, okay, which destroys sperm. It destroys sperm. The copper base destroys sperm trying to enter the uterus. Okay, one IUD can prevent pregnancy for approximately 10 years. That is why I tell people there are some preventions that you take now, and 2 years later you want to remove it. After removing it, it will give you another extra 2 years again before you can get pregnant. That is why I always tell people, whenever you want to prevent yourself, go straight and walk down to the hospital. Ask them what is good for me. When they test you and they know what is really good for you, that is what they can give you. There are some persons, when they are preventing themselves from getting pregnant, some of those contraceptives they take, or rather some of those things they do, most times when you see a woman that is slim, after taking those prevention, she became fat. While some that are fat, they become slim. While some irregular menstruation, some they don't even see their menstruation. So that is why it is advisable you always go for what? Checkup. Like this now, which means if it can give you menstruation. IUD can give you, it can prevent you for 5 years for not getting pregnant. In other words, after 5 years of preventing you under copper base, it can last you for approximately 10 years before you can get pregnant, which means after 5 years you remove, you have an extra 5 years before you can get pregnant. Okay, so cramps, irregular period, spotting between period. So these are what the difference is. It has. You have cramps, you have irregular period, you have what spotting between period. So these are what the method, or rather these are the barriers of what copper based. And we have what implants as number 12. I told you I'm going to share with you 15. We have the implants as 12. Is a form of hormonal what birth control. Is a form of what hormonal birth control. Number 13, we have what natural family planning. Natural family planning. So we have to say which one is natural again. Yes, there is natural family planning. Okay, the natural family planning of what contraception involve tracking the menstrual cycle and avoiding sex when a person is in vital phase of what menstrual cycle. This is just naturally, which means know your cycle, know everything about yourself, and know your safe period. You are okay, and that one is very naturally. There are some persons, they will tell you things, they'll be having intercourse, they've never got pregnant outside wedlock, or they've never had anything to have unwanted pregnancy, because while they know their cycle, they know what their safe period, and with this you can manage yourself. This is natural. Okay, so 14, we have what emergency contraception. Emergency what contraception in case of unprotected sex or failed birth control, such as broken condom or failure to take the what contraceptive pill. Emergency contraception is in the case of what or unprotected sex, failure of failed what birth control, such as what broken condom or a fail to take what contraceptive pills. It is possible to use emergency what contraception to reduce the risk of what pregnancy. It should not be used in place of regular birth control method. So emergency contraception should not be used what in place for a regular birth control method. Two types of what emergency contraception is what emergency contraceptive pills should be taken as soon as possible after sex. So which means those little pills that you can take after sex are what emergency what contraceptive pills. And also we have what the copper IUD. The copper what IUD. It can be inserted up to 5 days after sex to prevent pregnancy. Then 15, we have a sterilization. Sterilization is between man and a woman. Man and a woman. So we have sterilization when a man or a woman can undergo procedure to reduce their effect, to reduce their fertility permanently. This is a procedure where a man and a woman has to reduce what their fertility permanently. Okay, for men we had a vasectomy, which involve what snipping what the tube that carries sperm, snipping the tube that carries towards sperm. While for the woman can have a sterilization procedure known as what tubal ligation. Tubal ligation. It involves what clamping of stealing the fallopian tube, which means they have to turn the woman's fallopian tube, and the man they has to what close the fertility of producing sperm permanently. So thank you for watching today. With this little of mine, I guess I'll be able to save some persons today. Know your circle, know your safe mood. Try to follow instruction. When an instruction is being given to you, try to follow it. Thank you so much. See you next time on my video. Bye.